Hey there, are you looking for help for a cervical stenosis problem? Have you been searching the internet trying to learn more about what this is and how it's treated? And is it possible to escape surgery from it because everybody's telling you that you might need surgery? Well, I'll explain a bit more about it, and I'm going to go over with you today the top 5 ways to keep a cervical stenosis problem from getting worse and how to avoid surgery for it. My name is Dr. David Midoff. I'm a specialist physical therapist over at Paso Manual Physical Therapy, and I see people with cervical stenosis every day in the clinic. We commonly find that they also have some arthritis in their neck, and in addition to the cervical stenosis, they're usually having pain down in the shoulders or the arms. These people come in with MRI reports. Doctors have told them they've had x-rays that show that they have the stenosis problem. Now, what that is where the spine is in the neck, the bones that come up with the neck. There's 2 types of holes within the spine for which the nerves can pass through. There's central canal, the central canal, which if you've got stenosis there, it's called central stenosis. That's where the spinal cord runs through, the big thick spinal cord. And that's the most dangerous type of stenosis you can get. A lot of times the stenosis there occurs because the disc is pushing into it. You've got a disc herniation and it's starting to creep up into the space where the spinal canal is, where the spinal cord lives. And then the other type is called lateral stenosis. That's where the holes in the sides of the spine where the nerves come out that go into your arms, those nerves can be affected as well because the holes in the sides of the spine are closing up. Stenosis just means that a hole is present and it's getting smaller. So on the lateral stenosis part, that can also be affected by a disc that's herniating, but as well as the height of a disc. If you have decreased height of the disc, then the bones are coming together and the holes in the sides will also get smaller as a result, and that can begin to pinch on the nerves in the neck area. Now let me cover with you the top 5 ways that you can stop this from getting worse so that you can avoid surgery. Number 1 is stay hydrated. Discs are critical for this kind of situation. And what we know about discs is that they're over 70% water-based. So making sure that you're hydrated every day as you go forward in life is critical to make sure that you have proper disc health so you don't lose any more height in your discs so you can maintain the spaces where they're at. Number 2, avoid twisting and turning exercises or stretches. So you'll see exercises and stretches if you ever Google or look on YouTube for ways to move your neck or shoulders where they turn their head or you tip it this way or you twist as far as you can. And sometimes it can feel kind of good to do that because you've got tight muscles in your neck associated with this or in your shoulders as well. And it feels good to just put a stretch on it. But what most people don't explain is that discs, the actual discs themselves, they are not well suited to take twisting and turning forces. Discs are designed to take bending forward and backwards forces decently well, and also compression it can take pretty well. But what they're poor at doing, at taking, is twisting and turning. So you want to avoid twisting and turning exercises and stretches. Tip number 3 is avoid stretching in general. Now, if you absolutely need to because it's either that or you take a pain medication, then I'd say go with the stretching. But more often than not, about 9 times out of 10, there's some weakness in the neck and shoulder area that's leading into some muscle getting tight, and that's why you feel like you need to stretch because you feel that tight muscle. So a much better way to address the stenosis problem in your neck would be to follow tip number 4, which is to get stronger neck and shoulder muscles. This, for almost every stenosis case I've seen, has been the real cure for the problem. It really stops the stenosis from progressing and allows people to get better sleep at night, move through the day easier, be able to pick up heavy things without making their neck hurt worse, even increase their flexibility without directly stretching it or turning it. When you have proper strength through your shoulders and through your neck, the joints in the neck bones actually get offloaded and they move with better quality, and this sets up the environment for having a healthier disc, which takes pressure off the holes where the nerves come out, so that can theoretically reduce stenosis. Now, it's not proven that stenosis can be reversed, but that doesn't mean that it can't happen. That just means that we haven't researched it. because what usually happens is when people get better because they've got stenosis problems, they don't go back for an MRI after they're already better. They continue with their life. They don't go back for x-rays. They stay away from the doctor's office. So we don't have a whole lot of evidence that the stenosis got better, that the hole got bigger, that the nerves are alleviated. Just people feel better most of the time, so they get back to doing what they were doing before. But it's my belief that it probably does begin to reverse, and if you keep up the strength in your neck and shoulders, you're likely going to have a better MRI after you strengthened than when you were dealing with the stenosis problem. Now, tip number 5 is by far the best tip. Get expert help. If you work with a specialist physical therapist or somebody that knows how to handle cervical stenosis without medications and injections and surgeries, you're going to expedite the process of getting this cervical stenosis problem under control without having to get a surgery or rely on injections or pain medications. Here in the clinic, we'll look at every single joint in the spine. We'll look at all the nerves that come out. We look at the shoulders. We have to look at the upper back as well. We factor in the entire body into how that is creating your cervical stenosis problem so that we can find the root of the problem, address that to get your relief and results for the long term. We don't do short-term fixes here. We are interested in the long term so that you can avoid surgery, not get injections, and not have to rely on pain medications. I hope these tips were helpful for you. If you want to learn more about neck and shoulder tips, I encourage you to go over to our channel and find the playlist for neck and shoulder problems. You'll find tons of videos that will help you learn more exercises, stretches, get more advice about how to handle neck problems the right way so that you're not wasting time and potentially getting worse. I also encourage you to hit subscribe and hit the little bell icon so that you can get notified every time that we release a new video so that you can get the best up-to-date advice for neck and shoulder problems. I wish you the best of luck in fixing your cervical stenosis issue. Have the best day.